everyone, and in this video today we're going to be focusing on some exercises that can help you if you are struggling with sciatic pain. We're going to go through some specific conditions that can be caused from sciatica, such as degenerative disc disease, herniated or slipped discs, spinal stenosis and piriformis syndrome. In this video there are going to be 6 different exercises that we're going to focus on. Some of these exercises will overlap with the different conditions, but I will be specifying what exercise is to do with what condition for you today. We're going to be going through 6 different exercises today. Some of them may overlap with the condition, so the same one for maybe 2 of them, but I will be specifying what exercises is best to do with which condition that you may be suffering with. So the first exercise we're going to be looking at today is a deep glute stretch, and this is most prevalent for people that may be suffering with piriformis syndrome. So your piriformis muscle is a deep gluteal muscle, so this stretch will definitely be targeting that to help release any tension and pressure that's caused on the sciatic nerve, which is causing the sciatic symptoms. So we want to have laying down with our knees bent, taking one foot across our knee, lifting up and interlocking our fingers on the opposite leg and then pulling towards us. And in this one you will feel a nice stretch through the piriformis gluteal muscles around here. And if we want to hold for a few seconds and then just relax, and then we're going to repeat that on the other side as well, the same motion, pulling towards the chest for a few seconds and then relax. And we're going to do this 10 times on each leg. Perfect. And our second exercise that we're going to be doing is a knee to chest stretch, and this is going to be helping if you have piriformis syndrome or spinal stenosis. So the point of this exercise is to gap the joint and help mobilize our lower back. So we're going to do one at a time in the same position we were before, but in this case we're just going to take one leg, we're going to pull towards us to our chest, and we're going to hold for a few seconds, we're going to relax, and then we're going to repeat that on the other side. Perfect. And then a small progression, we can take both of them together and again pull towards our chest. And we're going to hold these for about 3 seconds, and we're going to do it 10 times on each leg, or we're going to do it 10 times with both of our legs together. Another one that we can do that is another small progression is we can be seated like this, and then we can take one knee to our chest and hold like so, and then again we can repeat and do this on our other leg as well. And we're going to hold those for about 3 seconds and do 10 on each leg. And our third exercise is going to be knee sways. This is going to be for people if you have piriformis syndrome, spinal stenosis or a degenerative disc disease. So same position as the other 2 were anyway, and in this case we're going to take our knees to the side as far as we can go. We want to keep the top of our back nice and flat on the floor, and then we're just going to go to the other side. And again, this is going to help to gap the joint and help mobilize our lower back. And we're going to do that 10 times on each side, nice and slow and controlled, as far as we can go, not exceeding the threshold of any pain. Our next exercise we'll be doing is called a glute squeeze. So it's basically what it means in the title of it. So again, we're going to be laying down, and what I want you to do is to put your hand under your lower back, because we're going to tilt our pelvis, so push our lower back into the bed. We're going to engage our core muscles, and we're going to squeeze our glute muscles as hard as we can and relax. And again, making sure that lower back is right flat on the floor, and again engaging the abs. Squeeze those glute muscles and relax. And this particular exercise is to do with spinal stenosis, herniated or slipped discs or degenerative discs. So again, we're going to do that 10 times with a couple seconds hold in between each one. Our 5th exercise, again, it's very similar to the one before, the glute squeeze, but we're just not going to be squeezing the glutes. We're just going to be, again, hand under our lower back, push the lower back into the bed and engage those core muscles. So it's basically a pelvic tilt, but not doing both motions. So just push down, engage and relax, and then push down, engaging those core muscles and relax. And we're going to do this 10 times. This also helps with piriformis syndrome, spinal stenosis, herniated or slipped discs and degenerative discs. So another form of exercise that you can do isn't like the ones I've shown you, but instead it's like swimming, cycling and some gentle walking. This is all going to help keep everything nice and mobile because we want to keep moving. We don't want to be sat still for ages because it's just going to worsen up all of those symptoms. So we want to keep our body moving, but we want to do gentle motions. Swimming is lovely because it's a non-weight bearing exercise. The water helps to support us. Gentle walking, as I say, nothing too quick. Nice flat terrain, no hills, or cycling as well, as again it's a non-weight bearing exercise, but it's getting that motion and mobility through our lower back and our legs and keeping everything moving. Also in this video, in the link below, is a blog and a poster that is also attached, and this delves into a lot more detail about sciatica. The blog goes through what exactly it is, how to care and maintain for it, treatment, and a lot more detail about it as a whole. The poster is accompanied by this, but is a much more simplistic version of the blog as a quick read for you guys to understand exactly what's going on. So within that you have 3 different sources to use with the videos as well. I really hope that this has really helped you, and I really hope to see you at the next video. Thank you.